Hello, this is Christopher South, the Easy EMT, and tonight we're going to be looking at nutrition. And this curriculum is brought to you by Jones and Bartlett Learning. So you can find all of the course material tonight on www.jblearning.com. And this is part of the book, which is the Community Paramedic curriculum. Hope you enjoy it. So let's talk a little bit about nutrition. And it's one of those things that we don't think about quite often, but believe it or not, we've all heard this at least once in our life, is that you are what you eat. Now, most of us as paramedics, EMTs, folks who work in EMS, and even the general public, we don't think much about nutrition. We just kind of buy and eat either what's affordable or what tastes good and kind of go with it at that. Not thinking that we should eat based off of what the body actually requires for our body to function at its optimal. And so that's what we're going to talk about tonight, is looking at not only for ourselves how we can be a little healthier, but also to think about our patients and how their nutrition affects their health, and how getting on a better diet, and I'm not talking about diet to lose weight, but just better nutrition overall will make your patients and you healthier, and hopefully will live a long time. So let's get into it. So our role is to raise the bar of paramedicine. Now we want to go beyond the scope of what paramedics do. And for us to go beyond the scope of what paramedics do, we have to have a greater understanding of what is happening in the body. And one of the things that I've learned here pretty recently, working with my friend who's a nurse practitioner, is she has really been encouraging me with nutrition and learning how to eat better. When I say eating better, it's not where I'm eating healthier per se. It's eating better is picking out things that are going to be more of the energy that I need to do the things that I want to do every day and to live a life that I want to live. And so with that is going and looking at all this material and saying, wow, it is really amazing how nutrition, medication, exercise, moving and everything is so simple to do and has a huge impact on our health. But by not doing those things also has a huge impact on our health. So for us, we have to be role models for patients and peers, and that can be difficult. So when we first hired our nurse practitioner, she came in and one of the first things she was really excited about was doing wellness stuff. And I was like, okay, this is going to be good. I like wellness stuff. I used to run, and, I'm trying to get back into it. And one of the things that she said is that we have to lead by example. And so every day we eat healthy, we live that lifestyle, we exercise, and being that role model for patients and peers. And you'll be really, I guess a good way to put it is, you'll be surprised at how many people watch you, number one, and number two, how many people will follow your example and will pick up on this stuff. It's amazing. So we have to understand basic concepts of food and nutrition, which we're going to be doing tonight. And we're going to learn how to assist patients in following a food plan. So let's take a look at the evolution of nutritional guidelines. And let's take a look at and reflect better on the understanding of nutrition and the changes in lifestyle. So over the years, all right, what nutritional guidelines that have came down from our friends at the government have changed over the years. Now let's take a look back at the early 1920s and 30s and everything. They used to really promote a couple of things, which was getting plenty of carbohydrates, fat, and protein. And the reason for that, now we would go, oh my God, that sounds horrifying. Why would anybody do that? You just get fat eating that way. Well, back then things were a lot different. People worked, physically worked. They didn't have computers to sit in front of. They didn't have video games or anything. They didn't have cell phones. They actually worked. They worked outside. And because of that, they expended a lot of energy, and it was important for those diets to reflect what they needed. So now we need to get our diet to reflect what we're currently doing. Now, most of us don't have a strenuous job where we're doing stuff. Even if you're in EMS right now and you're getting in and out of a truck and everything, it seems like it's physical activity, but you're going to do a lot of standing and a lot of sitting and not really doing the activity like people used to do. So with that, our diet needs to change, and it needs to reflect more of what we do. And for us, we need to get a diet that is going to help us instead of hurt us. And so you can go to the United States Department of Agriculture, the USDA. They have a choosemyplate.gov. Great resource to go into and look around and see what the recommendations are for you as an American on how we can eat better. So here are the current guidelines. So the current guidelines state that eat at a caloric level to maintain a healthy weight. So you're going, well, that sounds really good, Chris, but how do I figure out exactly what that is? And the easy way to do that is for us is to go in and go, okay, well, how many calories do I need? There are plenty of websites out there that will tell you what your caloric need is versus how old you are, how tall you are, your BMI and everything will tell you about what you need to eat every day. So if we know how many calories that we're going to need, we need to figure out, all right, I'm going to burn this many calories today. And really losing weight and staying at a healthy weight is really simple. It's calories in versus calories out. So we want to focus on a variety, a diet that is varied, but it's nutrient dense. Remember, a nutrient dense diet. Now you can eat stuff that's big, that'll fill you up and everything, but may not be very nutritious. It may not have good value for what you're bringing in. So we're going to talk a little bit about more of those kind of things. We want to limit added sugars, saturated fats, and sodium. And we want to shift to healthier foods and beverage choices. One of those big beverage choices that we need to really get used to and get more in us is water, just regular old water. And we want to support healthy eating patterns as we want to eat healthy and make that where eating healthy is part of our lifestyle, is a healthy lifestyle, that it isn't a diet that we're trying to do or to stick with for a specific goal, but it's a lifestyle change. It's a change in how we eat. So we want to ensure a balance of, and this is what we're talking about as a balanced diet, not a very specific diet, but we want to eat a balance of carbohydrates, proteins, fat, vitamins, minerals, fiber, and phytochemicals. We're going to talk about all these. So the U.S. Department of Agriculture currently defines 5 food groups, which include fruits, vegetables, grain, dairy, and protein. So the nutritional components of food and the diet for normal human growth requires 45 essential nutrients. So we have to have 45 of them. So deficiencies, we'll talk about in a second, create negative health outcomes. Also beneficial include fiber and phytochemicals. Fiber is really important, as it really helps in our digestive tract. It helps us to feel fuller so we don't eat as much. It also helps to clean us out, which is good. So let's take a look at the 6th group of essential nutrients. So our vitamins, it comes from things like our fruits and vegetables. Minerals can come from dairy and proteins. Fats, so we want to think about good fats. Fats can be found in different types of oil. Proteins, of course, again, think about proteins more than just like meat, like like steak and chicken and stuff. But proteins can also come from beans and things. Carbohydrates, and of course, water. And this is the 6th group of essential nutrients that we need every single day. So there are 6 classes of nutrients. Now, the first thing we're going to talk about are macronutrients. Macronutrients include carbohydrates, proteins, and fats. They are needed by the body in large quantities to make energy. All right. So micronutrients are vitamins and minerals, and they're needed by the body in small quantities. And one of the big things we need, of course, is water, high quality H2O. So carbohydrates, all right. So I've been living in the Midwest for the past few years, and I love this picture. It kind of reminds me of what I call home these days. North Dakota. Carbohydrates are made there. They're made of carbon, hydrogen, and oxygen. They are commonly described as starches or sugars. They are found in fruits, grains, vegetables, and legumes. They are simple or complex. Let's look at each one. Lipids are fats, and they contain carbon, oxygen, and hydrogen. They are found in meat, dairy products, and some plants such as avocados, olives, and coconuts. And those are great sources of fats right there, by the way. There are a type of lipids, which include triglycerides, phospholipids, and sterols. So a macronutrient. Now, lipids, we can have fatty acids. Now, an excess in dietary fat, all right? So we have dietary fat. We get too much of it. And what happens is the body is we have exceeded what we've brought in versus what energy that we have put out. And so your body will store that, unfortunately, in the form of fat. And there's two types of fat. We have visceral fat, which I think is really horrible. Is visceral fat is the fat that tends to get around your organs. All right. One of the big things is things like fatty liver and things like that. And we have what's known as subcutaneous fat. And subcutaneous fat is the stuff that we can see. All right. It is what we see on our, our belly, for example, is that subcutaneous fat. Both are hard to get rid of, but you can get rid of a little bit of help. So lipoproteins, now we have very low density protein, which is VLDL, intermediate density lipoprotein, and IDL. But we're going to take a look at the high density and low density lipoprotein that we should be concerned about when we definitely go and have our cholesterol checked. All right. So HDL, high density lipoprotein, we can think of HDL as the healthy. All right. This is the healthy. When we're looking at our cholesterol, it's the healthy cholesterol. So think H as healthy HDL, healthy cholesterol. LDL is what we know as the bad cholesterol, which is the low density lipoprotein, LDL. And so when we think of LDL, think of L for lethal, L. So trans fatty acids raise LDL, which is the bad cholesterol, and reduce the HDL level, which is the good cholesterol. And with that, we have increased risk for atherosclerosis. So the picture that we have right there is the hardening and the narrowing of an artery due to atherosclerosis. And atherosclerosis can lead to really bad things like heart attacks and strokes. So proteins transport oxygen, vitamins, and minerals to target cells. They act as enzymes to catalyze chemical reactions and also act as hormones that serve as chemical messengers for regulatory functions. Very important to have good proteins. All right. They maintain fluid and acid-base balance and serve as components of antibodies that support immunity. So getting plenty of protein is good for you, helps the body to be able to function the way that it needs to. So if not enough protein, the body will break down muscles to access stored protein. And this can cause things such as wasting of organs and other tissues. And we can see that a lot, especially with our elderly, as we can see a lot of our geriatric patients that have that, but we can also see this when we don't have enough protein and patients who are maybe diabetic and stuff, as we can start to see muscle wasting is because of a lack of protein and too many carbohydrates. Too much protein, on the other end, can lead to kidney problems, osteoporosis, heart disease, obesity, gout, and even some cancers. Balance, balance, balance is what we're looking for, folks. Vitamins. They are organic compounds that contain carbon and hydrogen, and in some cases, other elements. They keep organs and tissues functioning. We have to have vitamins and minerals in our body. So how do we get those? So vitamins do not yield energy directly. Their roles in the extraction of energy from fats, proteins, and carbohydrates. They kind of help in making everything work. They are fat soluble or water soluble. So let's take a look at some of our vitamins and what they do. All right. Antioxidants include vitamin E, vitamin C, and carotenoids. Coenzymes includes the 8 B vitamins, and all those B vitamins are fantastic. Bone health includes vitamin D and vitamin K, and vitamin K is also very important in blood clotting. And our vision is directly connected to vitamin A. So let's take a look about some of these. So minerals are simple inorganic substances, and there's at least 16 that are essential to health. There are macro minerals, which include a couple of things we've been talking about in this curriculum, which is sodium, potassium, and calcium. So let's take a look at some good sources of minerals, which include avocado, broccoli, almonds, white beans, asparagus, Brazil nuts, sesame seeds, okra, edamame, tofu, sardine, cheese in small amounts, oranges, figs, milk, and good old collard greens if they are cooked the right way and not smothered in oil. So macro minerals also include fluoride, phosphorus, and magnesium, which you can see are all electrolytes. So the purpose of that with all of these is that it helps with our bone matrix, nerve function, blood clotting, muscle contraction, and of course, cellular metabolism, which helps give us energy. So water is so important, and there's such a huge, so many patients are dehydrated. It's because they don't get enough water. So let's take a look. A 160-pound man should have 99 pounds of water, 27 pounds of protein, 24 pounds of fat, and 10 pounds of minerals and glycogen to make up that person. This is what should happen. But a lot of times we don't. We typically have less water, less proteins, and too much fat. So water helps us to control our temperature in our body. It's also important in the lubrication of joint and in transport of nutrient and waste. And it also helps to facilitate the metabolism so we use our energy better. And it also assists in the maintenance of acid-base balance. And so when we don't have enough water, all of these things will not work right, and we can start to develop some issues. So hydration is super important. Drink enough water. After a while, if you start kind of forcing yourself to and getting in a habit of it, once you get into a habit, drinking water is easy. So dehydration can develop when the body does not have enough water, and it can lead to simple things like constipation, which isn't simple when you're when you have it. High blood pressure, heart disease, glaucoma, and diabetic complications can all occur due to dehydration. Now, remember, with everything here, there's always too much of a good thing, and this can include something called water intoxication. This is where a person overhydrates beyond the kidney's ability to eliminate the excess water. Water intoxication can be lethal. So let's take a look at components of a well-balanced diet for a healthy adult. So we need a template for good nutrition relies on 2 basic concepts, just 2. The first thing is that we maintain a calorie balance over time to sustain a healthy weight. So here's the caveat with that is we have to get to a healthy weight before we can sustain it. So we have to get to a healthy weight. And so the way we do that is we find out what is needed to sustain a healthy weight. And that's how we eat now. And the weight will start to come down, but we have to focus on getting to a healthy weight. So we want to focus on, this is the part 2 part, is focus on consuming nutrient-dense food and beverages, is bringing in things that are good for us. At any step, now we can have some issues that can hold us back from being able to have good diet. So here's a couple of things. At any step in the digestive process, patients can have problems. We can have problems that arise. And here's a couple of influences on digestion, which can include psychological, chemical, and bacterial influence. We can also have issues that include things like constipation, diarrhea, lactose intolerance, gas, gastroesophageal reflux disease, known as GERD, and colorectal cancer can all cause some issues with digestion and absorption. But drug interactions can, the nutrients that we bring in may not work because certain foods and nutrients can enhance and make things either better or interfere with the effects on drugs. So it's important for us to know which foods we can can include in our diet and which foods we should avoid based off of what drugs that we are taking. And we need to be aware of the common drug interactions. So if you have questions, ask your pharmacist or your medical provider about the medications that you're taking, and also ask if there's anything changes in your diet to make them work better. So how a nutritional assessment is performed. All right. So we need to ask ourselves, all right, so number one, well, who makes the nutritional assessment? How is it done? How is it performed? And so with all of this, we're going to find out exactly how all of this is done. It's done by a nutritionist or under the direction of a patient's physician, and they do it by evaluating current nutritional health risk or deficiencies in their diet. There is a template of the patient's diet compared against dietary standard, and they try to match up what is best for that patient. And a lot of times, if we can't have a one-size-fits-all approach, and we're going to talk about how to approach patients here in just a second, so hang tight. So a weight assessment. Age is a considerable factor, is because we want to look at, like when we're looking at BMI and everything, and the patient's weight should be based off of their age, their height, for example. So overweight, obesity. When we have a patient who has too much weight, there is a risk of heart disease, stroke, diabetes, hypertension, metabolic syndrome, and cancer. Oh, Lord. If they're underweight, a patient who is undernourished can have underlying disease or other factors. One of the main things that we're seeing with most of our patients is that they tend to be overweight. So a patient who has chronic alcohol use, with that, it can cause or exacerbate mental health disorders and may interfere with nutrient absorption. So it may also cause damage to the lining or gastrointestinal tract esophagus, and contributes to poor eating habits and patient being undernourished. On the EMS side, we're quite familiar with folks who have chronic alcohol use, and oftentimes we may give them thiamine because of that, is because of them being underweight or being malnourished. So let's take a look at the basic food plan. Now, the basic food plan is written food plans created by a nutritionist for a couple of things: scheduled eating, when the patient is going to eat, weight change processes if they want them to gain weight or to lose weight or to maintain their weight, and improve meal planning. So the goals it needs to be patient driven. All right. If you're forced to do something, you're probably not going to do it. But it needs to be patient driven, is where they come up with it, and that the goals are achievable, and those goals can be evaluated. So we have some metrics to look at, and we can congratulate our patients when they reach their goals. Community Paramedic's goal, that's us, is to help patients make changes that empower and motivate. We're that coach. We're on the sideline. Hey, you can do it. Man, I saw where you lost 2 pounds last week. Awesome job. Keep up that good work. And so it's important. And it's important for us to follow. Me and you, we need to also follow a good eating plan. Now, this is the DASH eating plan. So take a look at this. It says, eat this, eat vegetables, fruits, whole grains, fat-free or low-fat dairy, fish, poultry, beans, nuts, and seeds, and vegetable oils. And it says to limit these things. Pretty simple. Fatty meats, full-fat dairy, sugar-sweetened beverages, sweets, and reduce that sodium intake. This is an easy one to follow, and it's one that I tend to recommend to a lot of people. But when we are implementing the food plan, you need to know the patient's medical diagnosis. All right. Are they going to have challenges based off those diagnoses? If they do, we need to start thinking about how we can help. And those challenges in terms of performing activities of daily living. And we need to think about everything that's associated with that patient's diet. Do they have access to food? Is that food nutritious? How do they get it? Do they have enough money to be able to go and to purchase nutritious food? Nutritious food isn't cheap. And so we need to think about, are there other resources that we can come with to make sure that this patient is getting the nutrition that they need. But we also need to be thinking about medications and supplements. Do they interfere with how that person eats, or does it, how that person eats, interfere with the medication? We need to also think about their lifestyle and also their cultural background. So when we are going through and talking to a patient, just like our community paramedic in the picture here is talking to that patient. So let's look at their food right there. Number one, there is nothing in there at all. Nothing that's really of value. It looks like there's some eggs in there, some syrup. All right. A couple of pops in there. One's a diet and the other one is not. There's a few condiments, but nothing really else. And so we need to speak and find out and be really kind of open-minded to speak to the patient. And we need to know that our attitude needs to change. And we need to think about the goals for that patient is getting that patient on a right path. And we need to also talk about the availability of nutritious food. If we put a patient is got a nutrition plan in place, but they're unable to follow it because they don't have access to nutritious food, it's just not going to work. And so we have to consider that and look at how we as community paramedics can overcome this. This is why it's so important to have resources available. I have my book of resources that I can go to and get out to those patients when it's needed. All right, so now we're approaching our patient. All right, both of them look quite uncomfortable here in the picture. But when we're communicating, and it has to be with respect and trust. Nobody eats perfect. All right, everybody makes bad choices and things, and that's all right. Because we have to understand that when we do see that with patients and things, is that we want to acknowledge and validate the patient's feelings, is because we have to think about it. There is a psychosocial thing that happens with food. Some of us have some very fond memories of food. How many, watching tonight, maybe you can put it in the comment section if you'd like, have ever had you have a smell of food and it brings back a happy memory? I know I have definitely had that in my life, is where I've had a happy memory of food. Smell like a certain thing that's cooking, like something sweet that reminds you of happy moments around Christmas or Thanksgiving and everything. And that can release good chemicals in your brain. And unfortunately, some people, that's what they associate with a good feeling is food. And it can lead over to obesity and stuff. There's always something that's psychological that goes along with a lot of these patients. So let's take a look at that patient's personal preferences. And we have to develop a plan that's tailored to the individual. This is not a one-size-fits-all plan. And those choices need to reflect customs, beliefs, and habits for that patient. And we also need to think about, well, the patient's budget. Can they afford this? And we need to get things that the patient can afford so they can stick to it, so they can create a healthy lifestyle that they can self-monitor and take care of. One of the things that we need to do is to be able to, number one, for us to understand, but we need to understand it to a point that we can teach our patients how to read the nutritional facts on a food label. So food labels require to include a statement of or identity, the net contents of the package, the name and address of the manufacturer, the packer or distributor, and a list of ingredients, nutritional information. May include preservatives and additives. So let's take a look at this one. So it says nutritional facts, man. It makes it easy for us. We know that we're going to get some facts here. Now, there are 4 servings per container, all right? So we have to find out what a serving size is per container. So we know that there's 4 servings per container, all right? So if we have 1.5 cup as 1 serving size, there's 4 servings per container. We just take 1.5 and multiply it by 4. And we know If somebody eats the entire thing, how much is going to be in there? So example, 1.5 cups of this serving, there's 240 calories. And with that serving size, we can go through and it's going to tell us exactly how much fat, cholesterol, sodium, carbohydrates, everything that we're going to see that we're going to be consuming is in there. And it's going to tell us our daily value, how much of a percentage of that we're going to get for our daily needs, which is based on a 2,000 calorie diet. And it's also going to tell you the amount that you're getting. All right. So the percentage value, or the DV, is based again on a 2,000 calorie diet. And some people may on a calorie diet that's either more or less than that. Remember, it's individualized. So the food labels, the nutrition facts, enables consumers to determine whether the product is nutritious. Just because it has a label on there doesn't mean it's nutritious. All right. So you can, this is kind of blurry. It's hard to see, but this is for a package of Pop-Tarts, strawberry Pop-Tarts to be exact. And they are, as you can see, there is no real nutritional value found within a Pop-Tart. There is some nutritional value in there, but mostly it's just sugar and fat is what's in it. They taste good, and maybe it's good for a treat every now and then, but you certainly don't want to be eating these for breakfast every day. So food labels, make sure we look at the serving size, is that we are following within that serving size and sticking to one serving instead of the entire bottle. And we need to look at the list of ingredients and the daily values and try to find foods that are nutritiously dense for us. If they're not, if they're just full of filler, which includes carbohydrates and fats, we probably want to stay away from them. So we have to provide education. It's one of the things that we're going to be doing for our patients. And we are going to help prevent food-related diseases by talking about these three things. Now, I worked on an offshore oil and gas rig for a number of years. And one of the things that we had to do was to go around and make sure that all of the, in the galley and everything, that the food was being prepared safely. And the reason for that is a foodborne illness could impact operations on the vessel. So food safety is very important. It's making sure that we are storing our food correctly, that we're not causing cross-contamination when we're preparing our food and everything. So we should go in and talk about it, and actually show our patients the importance of keeping our kitchens clean, having good hygiene, and making sure that everything's stored correctly. Very important. All right, so we go again. You're like, oh my God, he's going to talk about water again. Yep. I'm going to talk about water, is because water in the human body is so important. Without water, cellular metabolism is impaired. It doesn't work right. And when it doesn't work right, bad things can happen. In older adults, reduce thirst response and or kidney function. So we have to understand is that this is not a one size fits all. It's because older adults may not have that. They may not have that reduced thirst response when they feel like they're thirsty. So we need to drink even when you don't feel like you need to. So we need to have a measure of adequate hydration and color of urine. So here's a good rule of thumb. If you're peeing yellow, you're in danger, fellow. If you pee clear, have no fear. So with older adults, they can have age-related changes, and it can impact their nutritional needs. So let's take a look. The protein, vitamins, fluids, and fiber are more important in adults. So they need a higher concentration of vitamin D, folate, vitamin B6 and B12, iron, antioxidants, zinc, and calcium. So meeting our older adults' nutritional needs, the first thing is they may have medical conditions, but may make it hard for them to eat. Simple things like bad teeth, or they have dentures that don't fit correctly, can make it difficult for that patient to eat, where they're sticking more to softer foods. They can have medical conditions such as GI issues and things that may make it difficult for them to eat. But one of the big things is economic, social, and physical challenges, is where they're not able to get out to get the food that they need. They may not have enough money, be on a fixed income. And organizations like Meals on Wheels or food banks can be a huge supporting network for that patient in being able to meet the nutritional needs. So, nutritional needs of patients with chronic diseases. Now, dietary care should take all patient comorbidities into consideration, and it may affect the nutritional status. They'll often involve special dietary restriction. So, a diabetic patient is going to be on a diet, for example, that is more carbohydrate restrictive, and a patient who's on a heart healthy diet is going to be more aware of fat and different things. We should consider interactions of medications and supplements for all of our patients. So here it is, diabetes. Recommendations for type 1 include a healthy eating is by a plan that includes the reduction of carbohydrates, physical activity, and insulin by injection. So with type 2 or even with type 1, what can happen, unfortunately, is what we call the really, really bad eating habits that we can see here. Is your blood sugar drops in the middle of the night, and all of a sudden, to try to combat that, is you eat everything in the kitchen to try to get your sugar up. But here's the thing: if we eat healthy all the time and watch our insulin and everything, we can keep on a steady plane. So we're not doing that. So here are some recommendations for type 2 diabetes. The first thing is healthy eating, physical activity, and lots of blood glucose testing. And of course, weight control is one of the most important factor when it comes down to diabetes. And this is a fantastic name here. I just laugh every time I see it. So patients that have chronic obstructive pulmonary disease, here are some recommendations is we need to keep up energy for this patient. And we also want to make sure we're managing their weight is because if they have too much weight on them, it makes it more difficult for them to breathe. And we want to reduce carbon dioxide levels. So we want those patients to avoid eating cereal, white bread, pasta, and rice. And so foods that are good for COPD include fatty fish, oats, avocado, which I love, fresh fruits, brown rice, quinoa, eggs, nuts, and fresh vegetables. So with COPD patients, we want them to get out of the habit of snacking and reduce the intake of sugary, fatty foods, which can cause exacerbation of their COPD. And anytime they're eating, they should wear a cannula. Patients with congestive heart failure is that they should provide a sufficient calories for a healthy weight and provide protein needed for energy. So we may want to increase their protein for these patients. We want to definitely monitor sodium and fluid intake, which could exacerbate CHF. And so we don't want to have non-compliance where, with non-compliance as we can get over into breathing difficulties. So we want to make sure that we are medication compliant, sodium compliant, and fluid compliant. So patients with congestive heart failure should follow a heart healthy diet. It lowers fat and cholesterol, and nuts are a good option for patients with CHF. So mental health. Believe it or not, diet is important with patients with mental health. So mental health disorders are very common in the United States, and we've learned that increasing omega-3 fatty acids, folate supplementation, and limiting caffeine and increasing fruits, vegetables ensures good fluid and ensuring good fluid intake can help to manage some of these disorders. So vegetarian diets can be incomplete, and so they may be deficient in zinc, calcium, vitamin D, riboflavin, iron, and vitamin B12. Vegetarian diets are not bad for you, but as long as they are being done correctly, that you're getting all the nutrition that you need. So here's some recommendations for folks who would prefer to be vegetarian. Is getting good grains, vegetables, legumes, which are going to have lots of protein, nuts, and those protein-rich foods we just talked about. And depending on what type of vegetarian they are, they may be ovo-lacto, is where they introduce eggs and dairy products into their diet. So find out what type of diet that patient would enjoy and help them to make good living habits that are going to help us for life. So, guys and gals, what I want to tell you is the better that we eat, you are what you eat. And when you eat like just junk into your life, that's what your body is going to get out of it. If you eat healthy, you will become healthy, you will stay healthy. And so let's help our patients to stay healthy by bringing in good nutritional guidelines, recommendations into the goal for that treatment for that patient. And also lead by example by yourself is by getting healthier. You'll be glad you did. So this is Christopher, the Easy EMT, signing off. Thanks for joining us tonight. Have a fantastic day.